Folks, we are here at ASH, the American Society of Hematology annual meeting, where we are talking with Deborah Sims, journalist, blood cancer patient advocate, and CLL patient. Deborah, thanks for joining us.
Oh, thanks for having me. Great to be here.
Deborah, I'm wondering if you can tell us, what is chronic lymphocytic leukemia? We call that CLL.
So CLL is a cancer of the blood, and it's basically cancer of the B lymphocytes, which crowd out your bone marrow, and in my case, my lymphatic system as well. So I always tell friends it's cancer that can't decide whether it's a leukemia or a lymphoma, so it does it both. And at this stage, it is still an incurable cancer.
So can you tell us a little bit about your journey with CLL?
I was diagnosed at the age of 38, which is pretty young for a CLL patient. The average patient is a 72-year-old man, not a mother of 3 children under 7. And I had aggressive disease from the day I was diagnosed. So I had standard treatments in 2011 of chemotherapy. I relapsed 6 months after chemo. And I was headed for an allogeneic stem cell transplant using a donor's cells. And it was at that stage that I started exploring overseas clinical trials.
You've become familiar with City of Hope through your relationship with Dr. Siddiqui. Tell us a little bit about their role in fighting blood cancers.
I am a serious fangirl of Dr. Siddiqui. I've been seriously impressed with the City of Hope for a number of years. In fact, since I met Dr. Siddiqui, I've followed the work there. There's a real culture of innovation, and the trials are all very cutting edge. And so patients who are failing CAR T, I'm now seeing it doing by specific trials at the City of Hope, that there are more and more options becoming available in clinical trials.
So you're attending ASH as both a journalist and a patient. Why is a meeting like this important for patients?
I've been going to ASH now for 3 years. It's very sobering to be at these meetings as a patient, and I am there primarily as a journalist, but I'm asking doctors questions that are more for a patient audience than the normal interviews that are obviously mainly geared at scientists and doctors who haven't made the conference. I feel a great responsibility to moderate the information I'm hearing, knowing that a lot of patients who are watching this have only newly been diagnosed. They're looking for hope. They're not looking for negativity. They're looking for what's the cure.
Deborah Sims, thanks so much for joining us today.
Thank you. Great to be with you.